The Ministry of Health State Programs Manager for TB Leprosy, Dr. Komolafe Rotimi, has charged members of the public to show more empathy on people with tuberculosis and HIV/AIDS. At the advocacy campaign to end stigmatization organized by Initiative for Grassroots Advancement, Dr. Komolafe said Kogi State First Lady has put a lot in creating awareness to end tuberculosis and the stigma that comes with it. A reporter has more details.
The Kogi State government, in collaboration with Initiative for Grassroots Advancement, INGRA, has led an awareness to end stigmatization of people with tuberculosis and other health ailments such as HIV/AIDS, leprosy, Down syndrome, and many more. The organizer of the program, Catherine Odok and Amza Aliu, enlightening students of Kogi State Polytechnic and core members serving in Lokoja of their havoc stigmatization has caused people who have health challenges.
Again, discrimination can heighten that feeling of fear and panic. It heightens the sense of insecurity that we feel in school community.
The reason why nature made it that way, I should come out of pressure, is because during for fertilization to occur, that sperm needs to get to your cervix.
Dr. Komolafe Rotimi agitated for people to be intentional about spreading the information to end stigmatization on tuberculosis and HIV/AIDS patients, while he urged people to do proper checkup for early detection of ailments in their body.
Tuberculosis, HIV, and stigmatization is a very great problem we have currently. And for HIV, that's the one people know commonly that they are stigmatizing. I will also tell you that there is a lot of stigmatization against people with tuberculosis. When they see that somebody has TB, they don't want to associate with them. But I always tell people that before they dictate that this person has TB, he has been living among you. So what we advise is that please show more empathy, show more love to them. If you see somebody that is coughing, you can always encourage that person to go out and do the test.
The chairman of Kogi NGO Network, Idris Ozoveye, and the media practitioner Yemi Balogun appreciate the advocacy to end stigmatization and call on individuals to unite and take conscious action on warring against stigmatization of people that surrounds them.
So specifically what they've just done here today is that engaging these tertiary institution students to talk about issue of discrimination. Don't also forget that INGRA and other civil society organization has also partnered to work through the State House of Assembly to have anti-discrimination law on HIV and AIDS in Kogi State. That is in the works. I think it has been passed by the House. So it is time now to start sensitizing people. And the best place to do that is to start sensitizing our students, in the tertiary institution to know that there's a law that covers issues around HIV stigmatization.
Call is upon each and every one of us to take conscious action so that we would not be the reason why the other person is self-isolating and being suicidal. So we need to unite together to end stigma and discrimination of any sort, either because of your skin color, your race, your cultural background, or your belief system.
Students of Kogi State Polytechnic Okono Solomon and Ahmed Salatu share what they have learned at the sensitization program and advocate for fair treatment and social inclusiveness of anyone with HIV/AIDS and other health issues.
They taught us about not to discriminate the people with HIV/AIDS around us.
My advice to youth who have people who are vulnerable to health ailments are they should not discriminate them. They should allow them to have their own group. They should involve them in their daily activities in order not to lack in any activities.
In the same light, Ingram moved the campaign against stigmatization of vulnerable persons to the National Youth Service Corps CDS ground in Lokoja. The NGO educated and engaged core members to avoid gestures and conversation that lay stigma on people with HIV/AIDS, tuberculosis, and those who seek to engage in protected sex. The program officer for INGRA, Ayuba Abdul Fatai, stated that the conversation is to instill consciousness among the core members to shun stigmatization against HIV/AIDS and tuberculosis patients.
We're looking towards a time where persons living with HIV in the state are no longer discriminated by their HIV status, they are no longer stigmatized, they are no longer deprived of rights that they are entitled to as normal citizens living in the country. And this is also part of our effort to put out the bill that has already been passed, which is a bill to provide for persons living with, to stop for stigmatizations for persons living with HIV and AIDS in Kogi State. So that is what this activity here today is all about.
The lead advocate, Catherine Odok, said the massive advocacy is to create an enabling environment for people living with HIV/AIDS and tuberculosis to express and live a good life.
We are speaking to core members today to enable them to take informed decision. There is this myth that once you have HIV, then you're doomed. Once you have HIV, then there is nothing more to live for, and that's just myth. You can be infected and you still take responsive decision by getting treatment, staying consistent with the treatment, and live a fulfilled life.
The core members engage actively in the conversation and share their opinion on stigmatization and their fears, while speakers gave demonstrations of protected sex and how to detect symptoms of tuberculosis among the students of Kogi State Polytechnic. I am Abiodun Sadiq, reporting for MLC TV.